Anterior dislocation of shoulder. Shoulder joint is vulnerable for dislocation more often than any other joint in the body. The extreme mobility it enjoys jeopardizes its stability. The shoulder has an Achilles point at the inferior part of the capsule, providing the joint with a potential weak spot, so much so that 99% of anterior shoulder dislocation occurs here. About 95% of the shoulder dislocation is anterior, and the remaining 5% is mechanism of injury. Direct below on the posterior aspect of the shoulder, fall on outstretched hands. Following types of anterior dislocation of shoulder, ADS. DARE. Types are described: subcoracoid, subglenoid. Mechanism of injury. Clinical features. Patient complains of severe pain and arm is held in abduction and external rotation. Normal contour of the shoulder is lost, and there is anterior fullness of the shoulder. Adduction is severely restricted. There may be diminished sensation on the lateral aspect of the deltoid region due to axillary nerve palsy. Treatment. Closed reduction under general anesthesia, GAR, using the Koch's method, Fig. 18.4, of reduction is the treatment of choice. Open reduction is reserved for cases of failed closed reduction. Physiotherapy management. Aim. A complete range of active movements of the shoulder complex to be restored back to normal, or at least achieve the functional level. Initial 3 weeks, this is the phase of immobilization, and the affected arm is fastened to the trunk in a position of adduction and internal rotation. Wrist and finger are left free, and the patient is instructed to exercise them actively. Fig. 18.5. However, self-resistive isometric contractions to the biceps, triceps and deltoid are begun in right earnest. 3 weeks later, the strapping are removed and the limb is supported in a sling. Mobilization of the elbow joint to its full extent by intermittently removing the sling is advised. Mobilization of the shoulder is done in the following manner. Treatment. Closed reduction under general anesthesia, GAR, using the Koch's method. Koch's method of reduction of anterior dislocation of shoulder. The method consists of 4 important steps: mnemonic, team, T traction, longitudinal, E external rotation, a reduction, M medial rotation.